good afternoon. Welcome to the Lexicon Studio. My name's Noël. I'm the chairperson from the Women in Business Groups, and one of our objectives is to support women professionally as they develop in their careers. But also a very important aspect is obviously their physical health and their mental health as well. This month is Pinktober, which is breast cancer awareness. And I thought it was a great opportunity to invite Dr. Donna into the studio to share her advice and wisdom from her many years of medical experience. So thank you very much, Dr. Donna, for joining us today. I think I wanted to start maybe just the first question focused on breast cancer. Breast cancer affects 1 in 8 women globally, and I think everybody has known somebody who has gone through it. So I think my first question is what are the measures that women can take to help prevent breast cancer? That would be, I think that's quite a useful understanding.
Right, thank you, Noël. And I'm also a British Chamber member, so thank you. What can women do to prevent breast cancer? The dreaded thought of cancer. Well, self-breast examination is recommended, and really doing it by yourself. People come into my clinic, women, and they say, oh, can you examine my breast? Can you check? And I teach people, the women really, how to examine their breasts and how to also examine under the arm and look for changes. I think though, the most important thing I was thinking that's changed in the last 30 years or so, or even 40 years since I qualified, is the mammogram. The mammogram, of course, the X-ray can detect abnormal cells, abnormal areas in the breast way before you can feel it. So I think starting from the age of 40, getting a mammogram is one of the best things you can do.
How often would you recommend people get the mammogram?
Well, it varies in different countries, but some would say every year, some would say from 50. And if you're in a high risk category, for example, you've got a relative, a young relative, less than 40, who's passed away with breast cancer, then you really could be speaking to a breast specialist a lot sooner and having investigations earlier.
Is there, in terms of preventing, everybody wants to know preventing, is there things that women can do to help prevent it at all?
Well, if you're in the high risk category, and I say this, women who've got a relative, like a mother, an aunt, a grandmother, a sister with breast cancer, then they could consider the BRCA screening, the genetic screening. But really you have to think, well, if the screening test was positive, what would I do? Would I have a total mastectomy on both sides? For prevention, I mean, most of us are looking at the vast majority who aren't in the very high risk groups are looking at self-breast exam, they say monthly. You know, when you're in the shower, that's realistic. When would you examine your body? When would you look for changes? And then the mammogram, I can't emphasize that enough.
If it is detected, then what kind of treatment do you go under? What is your likelihood of overcoming it?
Right. Well, if it is detected, so it maybe would be detected by a biopsy, taking a sample with a core biopsy or a needle, often ultrasound guided control, from the area that's been detected as abnormal on the mammogram. And then you would look at the pathology and decide what to do. Should the breast be removed? Should the lump be removed? Should any lymph nodes be removed? And then afterwards, the good news is survival should be normal. That's changed dramatically in the last 40 years. There's more and more treatments developing for different kinds of breast cancer.
Just generally, I obviously run an organisation with Thais, mainly for Thais. Mm-hmm. Is the awareness within the Thai environment, is it a high level of awareness?
I think it is, because I think, for example, on big festivals, big events in Thailand, festivals, there can often be campaigns, like this month. Yeah. The Pink Ladies are running campaigns. There can be national campaigns on Mother's Day. So there is a lot of awareness. And I think too, every woman is fearful of breast cancer. And many Thai women too have had a relative with breast cancer too. So your best advice is really get yourself a mammogram and do self-testing on a monthly basis. Is there other things, like you read things about keeping yourself healthy, amounts you drink, etc.? Women, particularly working women, they have very little time. So it goes family, job, and often they put themselves last. So what are the things that we can do to help ourselves? Well, we can have a healthy lifestyle. So we can definitely, no smoking is important. Excessive alcohol, excessive alcohol is linked more with breast cancer risks. And obesity, especially after the menopause, is linked. And I guess too, one of the risks women ask about in their 50s is, well, if I'm going through the menopause, I've had the menopause, can I take hormone replacement therapy, or will that increase my risk of breast cancer? And again, you can look at someone's individual risks. And clearly, if they're from a high-risk group, like I've said, relatives with cancer at a younger age, around 40, 50, then hormone replacement therapy would not be advised, because it could cause a risk of breast cancer.
Okay. I'm going to change topics if you don't mind. So one of the more common issues I've seen, and I myself, I had my uterus removed, probably about 10 years ago. But what I'm increasingly seeing is a lot of our younger people that work for us, because I have quite a young team, they often have cysts, which I think they can be an indicator of cancer. What advice, when people are having period issues, pains, would you be giving to people?
For general cancer prevention?
Yes.
Okay. Well, generally, in younger women, cancers don't occur. They occur in older women, say, 40, 50, 60, 70 plus. And definitely investigating with an ultrasound, but a small cyst in the ovary is not usually a concern for cancer, and it can be monitored by ultrasounds and followed up to see if it's a more complicated cyst or not, or more than 5 centimeters was one of the golden rules we used to look at.
Yep, but it's important. I went through it. I just put up with the pain for a long time, and then I went in and I actually had a 10 centimetre cyst which had to be removed. Wow. So I've had a lot of people that do experience pain, and they feel this is normal. They don't want necessarily to go to the doctor, but to me it's very important that they go at an early stage to have it, to understand the risks of what can happen.
If someone has pain and we don't know it's important always to know the diagnosis. If a pain continues more than a couple of weeks, then I definitely think it's cause for concern. Or, just to see your doctor, have an ultrasound, find out what it is.
Yep, I think that's very important. Just flipping a little bit away from cancer and a little bit into women's mental health and well-being. I just wanted to explore just some of the common issues that you're seeing, and I don't know whether COVID as well. I know a lot of people are saying COVID it has been a big strain on people. What are you actually seeing kind of in your patients just generally?
We're seeing a lot of stress, for sure. So much stress, sleeplessness, depression, anxiety. We've seen more people saying, I just don't think I can go to work today, which has been unusual. Referring people to counsellors. The counsellors seem to be busy. On the other hand, we're seeing people who are looking after their health and taking steps. They thought, well, this is the chance. I've really got to do something now.
What sort of things would you be recommending for people to take to look after their mental well-being? I think they call it mental resilience now.
Mental health. Well, first of all, you know, we talk about exercise, sleep, counselling, and there's lots of online counselling now. You could look at forums, what do people do, how can they, or reading information, but sometimes we've just got to get through the day. And taking a tablet, I say to patients, it can be a quick fix, but it really will help. And it will make a difference by boosting your serotonin over some time. And then if you practice the exercises, the mental health exercises at the same time, either with a counsellor, then you're going to get a lot more benefit, because it'll give you the courage to make these changes.
And in terms of like looking after like a big team, what are the sorts of things I would be looking for? I know this is quite a difficult question.
For your own staff?
For the own staff, yeah.
For employees, well, I think there should be an awareness that if someone is stressed and staff are worried about someone, always to just mention it. I think mentioning it, or if you have a concern, not doing about maybe someone else, someone you know, not doing anything about it is the worst thing. And I know we can all look back in hindsight, but just watching people.
So thank you very much. In terms of just in terms of MedConsult, because I think that's been in Thailand for almost 20 years now. So what are the sorts of services that you provide that can help people? Because I know that you mainly focus on expats, I think is your main customer base.
Yeah, well actually we're now seeing many Thai customers.
Okay.
It's, I think like a lot of businesses, we've had big changes in COVID. And so what are our main services? Well, COVID testing has, for us, it's been a big service. The others are checkups, cholesterol tests, lab tests, following them up. The labs that we work with in Thailand are really, really good, and there's a lot of private laboratories. And then another side would be even the mental health, of course, and sometimes confidential issues that I was talking about to someone else this morning. You know, that you really might have worried if you could have an HIV risk, or you're just worried about something, and that's when people may come to see us. And again, the big thing that Thailand's known for is Botox and aesthetic medicine. So I've certainly taken advantage going to endless courses on Botox and fillers. It's just because I think also if you feel and look okay, you actually feel well. There's so much that affects our health.
Yeah, okay, so thank you very much. Just as a final, you've obviously been in Thailand for a very long time. I wondered whether you would want to share with the BCC just a little bit about yourself and maybe what brought you here.
Yeah. Hi, well I came here 30 years ago, and I always say I don't want to show my age. And I came with my husband, who's a civil engineer, when Thailand was building all the expressways, and there was big international teams of consulting engineers, and my husband came, and I just said, oh well, yeah, I'll come too. But I'd already written letters, and I got a letter back from a Thai NGO saying I could come and work with them. So, you know, what was your question?
Tell me about yourself.
Oh,
Tell me about yourself. What brought you to Thailand?
Oh, yes.
Maybe what you love about Thailand, something that the members would like.
Yeah, I mean, so, you know, surprisingly, one thing is, I didn't really like Thailand at first. I thought, oh, goodness, you're supposed to love this place. The people smile, the food's great. But I found clearly the culture shock quite a difficult thing the first few months. And I say to people too, you know what, if you find it difficult, you're probably going to end up loving the place. And you will find what you want in this fast city, but sometimes what you want, or the group of people you want to you know, join with, it'll take you time to meet. And I guess too, we have 2 children. The international schools here are great, and we had an easy life and have enjoyed it. After a few years of being here, I began to think, you know, I kind of really like this place. And I think that's the way Thailand
You've stayed
is.
here for 30 years,
Yes.
so I've been here 22. So anyway, thank you very much for joining us and for the insights and the advice you've given. Thank you.
Oh, thank you, Noël, and thank you, British Chamber.